This is our Diet and Cancer Myths webinar hosted by the Nursing and Allied Health Professionals programme at Cancer Research UK Cambridge Centre. We've got an amazing group of panellists to answer the questions you've sent in. So I'm going to let them introduce themselves first. Claire?
Thank you. Yeah, I'm Claire Lamb. I'm one of the upper GI oncology dietitians at Addenbrooke's Hospital in Cambridge.
Hi everyone, my name's Rachel. I'm a manager in the health information team at Cancer Research UK.
My name is Victoria. I'm a oncology dietitian at the Royal Marsden, and specifically at the Royal Marsden School, teaching oncology masters modules.
Hi, I'm Helen Webster. I'm an oncology dietitian in Ninewells Hospital in Dundee, and I specialise in upper GI and HPV cancers.
Good morning, my name is Melissa Mogor. I'm an award-winning public health nutritionist and I work mainly around cancer prevention and survivorship. I work now with a charity called Nude Health, and we work to develop programs to help to increase access to credible information and health services for people living with and beyond cancer.
Thank you. Perfect. So we can see we've got a real broad range of input and experience from everyone there. And my name's Laura and I'm a dietitian as well by background, and I'm co-lead of the Nursing Allied Health Professionals programme here at Cancer Research UK in Cambridge. So thank you so much for all the questions that you've sent in. There's a huge number and I don't want to talk for too long. I'm going to go to our panellists. So we've had, like I said, it's a popular topic. We've had a huge number of questions. So we're going to group them into themes a little bit, and we're going to start looking at prevention. So for people that don't have cancer, to prevent getting cancer in the first place. So I'm going to go straight to your questions. The first one is, what are the misconceptions around red meat and cancer risk, and how can we provide balanced dietary advice to patients? So who would like to answer that one?
I'm happy to jump in on that, Laura.
Lovely.
Yes, so red meat is definitely a hot topic when it comes to diet and cancer. Some people have the impression that potentially you need some red meat to feel a bit more strong. You know, is it part of our ancestral diet, for example? That's not the case. It's, you know, people can live very healthily without red meat at all in their diet, and it is one of the causes of cancer, and in particular processed red meat is one of the things that has a direct cause for cancer. So there's lots of other ways you can get the things that red meat would provide in a diet. So iron can be found in lots of other vegetables. So yeah, it is one of our things that we encourage people to consider, is cutting back on processed and red meat.
Can I just add to that as well, please, Laura? Amazing what Rachel said, but I will also want to add that you can eat some amounts of red meat. So lots of the recommendations are to eat red meat no more than 3 times a week and try to keep it between 350 and 500 grams. So yeah, so you can eat some red meat, but as Rachel said, there is links with red meat and bowel cancer. And of course, red meat can be high in fat, like Rachel said, particularly processed meat. So there are links with excess calorific intake leading to excess weight gain, which does increase the risk of up to 13 types of cancer. So yeah, so it might be worth looking at your portion size and seeing how much red meat you're eating and cutting back on that if you do eat red meat. And as Rachel said, if you don't eat red meat, look at other sources which you could use to get that protein in. Yeah, that'd be it.
Wonderful, thank you both. So I'm going to look at the next question here. Does fried food or processed meat significantly increase your chances of getting cancer?
I could continue on from that. So like Rachel said, processed meat does increase your chances of getting cancer. It has been directly linked with bowel cancer specifically. And the reason behind the chemicals involved in the method of processing. So the usual chemical preservatives such as nitrates and nitrites and nitrates, and this is added to the processed meats. And that has a direct link with cancer, particularly with red meat. If you're having white meat, especially such as poultry or chicken and turkey, that has a low risk of cancer, particularly if there's no nitrates or nitrates. So it's really important to look at the back of labeling if you are having white processed meat, but if you're having red meat, then ideally it's to stay away from it. There's currently no recommendation for the amount of processed meat that's a safe amount to consume. So it's ideal to stay away from it. And when we talk about processed meat, we're referring to meat that has been processed through salting or curing. That could be like chorizo or salami. and especially dangerous when it's red meat.
Perhaps I can add as well to that. I think, we've obviously already dive right into the prevention messaging, but I just wanted to make a quick note that obviously we've got lots of different messages to share today on diet and cancer, and particularly cancer risk. But just because there are things that we can do to reduce our risk of cancer through our diet, it doesn't mean that people on this call who might have direct personal experience of cancer are to blame, or could have done anything to, it's not possible to know what caused an individual's cancer. So we're not trying to put the blame on anyone or the responsibility on anyone. But we do think that there are things we can do to empower people to improve their diets and hopefully reduce their risk of cancer. So I just thought that was important to add at this point.
Thank you. That is important, definitely. Yes, thank you. Let's look for another good question. Is it true that the varied phytochemicals in a rainbow plate lower our risk of getting cancer? And does the diet lower the risk of relapse for those who've been successfully treated? So phytochemicals are, that might be a word some people are familiar with and some people aren't, but that's chemicals made by plants. Who would like to?
Thanks, Laura. I can perhaps come in on that. It is a good idea to eat a range of colours in your diet. Fruit and veg, it gives a bit of an indication that you're getting a range of different vitamins and minerals through that. But it doesn't have a direct impact on cancer. It's actually more the fibre in fruit and veg, as well as whole grains, that makes the difference in terms of reducing risk of cancer. So any veg is better than none. So, don't hold yourself back if you can't find or potentially afford a range of different colours of veg in your diet. But yeah, basically the simple message here is the more veg you eat, the better. And yes, if you can, eating lots of different types is a great idea. But that in itself won't reduce the risk of cancer.
Yeah, and I can add to that, just as like Rachel mentioned, fiber is really important when you are having these phytochemicals. Essentially, you need to focus on the nutrients within the plant as opposed to just that specific chemical compound produced by the plant. And try to focus on getting your 30 grams of fiber in your meals. So speak with your health professionals, or even just look online and see how you can increase ways of getting fiber into your diet. People tend to think that it's easy to hit 30 grams, but it's quite difficult. So try to include fruits and vegetables, whole grains in each part of whenever you're eating, try to add that to your meals so you can try and hit that 30 grams of fiber. It does contribute towards reducing the risk of bowel cancer.
Lovely, thank you. So looking at another part of prevention, when we talk about food that's carcinogenic, does the evidence lean towards certain food groups, for example, meat, or how it's cooked, for example, fried or air fried, or the ever-growing processed food types?
Yeah, so Melissa touched on this in one of her previous answers. Sometimes we can get bogged down in thinking about the ingredients or the types of food or the methods of cooking, but actually it's more important for us to look at the overall diet rather than those individual bits of questions. So the reason that we suggest that is because a healthy, balanced diet has a big impact on our ability to keep a healthy weight. And that's actually one of the biggest driving factors in terms of cancer risk. So overweight and obesity does cause 13 different types of cancer. So eating a healthy, balanced diet that provides the right amount of energy for an individual, that's the most important goal. And that's the thing I'd really like people to take away.
Yeah, and to add, like Rachel said, it's like seeing your diet and your health more as a complex as opposed to adhering to one specific area. So instead of just avoiding red meat or just avoiding fried foods, it's more about understanding that you can increase or decrease your risk by eating certain foods in mass amounts and trying to do a bit of everything. So try to adhere to all of the recommendations as opposed to just picking out specific ones and just focusing on a specific piece of advice. So yeah, like Rachel said, it's more of an overall diet as opposed to just focusing on specific areas.
Wonderful, thank you. That can sometimes be a bit harder for people, I think, to know about all the different bits, but it also helps them not to worry about sort of specific nutrients. So another one on prevention. Are there specific, and it's sort of related to that, are there specific foods to eat regularly? And if so, how often and in what quantities, portions or otherwise, to help preventing getting cancer? And if so, which cancers can we prevent by eating these foods?
I'm really glad this question came up, Laura, because we have something called the Healthy Plate Model, which I think is a really wonderful tool for people who are thinking, oh, well, there's all these messages about diet. How do I actually put it into practice? You know, what do I do when I'm preparing my meals or my family's meals? And the Healthy Plate Model suggests half of your plate or bowl is taken up by fruit, veg, and salad. A quarter is taken up by starchy carbs, and that's another opportunity to get lots of whole grains in there. And then the other quarter is taken up by healthy proteins. So I think that's a really useful tool, both for people who are working with people who are trying to improve their diet, and for people themselves who are just looking to, you know, do something practical that can help in an everyday sense. Yeah, I'll leave it there in case Melissa's got anything else to add.
Yeah, absolutely. It's exactly what Rachel said. It's a great question. And what she said with the healthy plate, definitely exactly what I would have said. Making the whole grains, fruits, vegetables a major part of your meals. So the goal is to try to include them in every single meal that you have. It does help you to maintain a healthy weight. And as we've both said, that does help you to reduce the risk of up to 13 cancers. And it does specifically help to protect against cancer, specifically aerodigestive cancers like esophageal cancer or cancer of the mouth or the larynx, and it can protect against bowel cancer as well. Like we mentioned, these foods are high in fiber, and whole grain specifically has had some plausible anti-carcinogenic properties. So it is important to opt for grains that have both the bran and the germ. So yeah, like Rachel, exactly like Rachel said, opt for whole grains, fruits, vegetables. And in terms of how much we should eat, I'd say that the 5-a-day messaging is very widely accepted, at least in the West, and I'd say opt for that. So look at the 5-a-day, try to get at least 5 portions of fruits, vegetables, and whole grains and pulses into your diet. Try to understand how much a portion would be. So a portion, we tend to say it's 80 grams, but if you're not good at weighing, you can always use bodily measurements like a handful, for example, and that usually is like 80 grams would be equivalent to like 1 apple. So when we are speaking to patients or anyone who requires some advice, they tend to hear the numbers and get quite confused with it and think that it's so much harder to achieve than it may actually be. So it's really important to demonstrate and show them how easy it is to get your 5-a-day in, and also to stress the fact that your 5-a-day should be the minimum requirement, not the goal to strive for. That being said, of course, not everyone is able to eat 5-a-day straight away, but it's important to work towards hitting that 5-a-day and use that as the minimum threshold. So that's how much is advisable in terms of protecting against at least aerodigestive cancers and bowel cancers.
Lovely, thank you. Then sort of related to that, but this is sort of what we would call secondary prevention. So for someone who's had cancer, what dietary rules should be followed when someone has had cancer to prevent it reoccurring?
Yeah, I'll jump in on that one. So essentially, like we mentioned earlier, so once you've passed the acute phase of treatment, which is when your treatment is active and when you're more heading towards remission, you can follow the dietary advice for prevention. So you are able to, if you can, and if you haven't been otherwise advised, it is advisable for you to follow the prevention guidelines for cancer for people who have had a cancer diagnosis. Studies have found that it helps to reduce the risk of new cancer cases, it helps to reduce the risk of dying from cancer, also useful for reducing the risk of dying from other non-communicable diseases like diabetes or heart disease, and it does improve the quality of life for anyone who is living with and beyond cancer. So it can help with managing side effects, it can help with weight gain or maintaining muscle mass and minimizing muscle wastage if we do adhere to those prevention guidelines. So that would just be, again, like we mentioned earlier, limiting your the amount of red meat you're eating. If you are eating red meat 2-3 times a week, between 350 to 500 grams, making whole grains, fruit, vegetables, and pulses like beans and lentils a major part of your diet, not limiting in the intake of alcohol and processed meat. So these things will essentially help you even if you have had a cancer diagnosis, but it's important to speak with your healthcare professional, see if that is safe, and take it from there. Also important to note that when you have had a cancer diagnosis, the way you eat may be significantly different to how you were eating before. You may find that you can't eat a mass amounts of food as you did before, or you may find that your body is reacting differently to the foods that you previously had. And I would suggest to work with what you can at the time, and then consistently or gradually see if you can increase more of the healthy food that you should be eating. So where you are straight after you're in your remission phase and where you are a week or a month or a year is totally different. So I'd say continually introduce healthy foods into your into your diet and see if you can take more of those foods, as opposed to seeing it as once you've had a diagnosis, your life has totally changed and you can't go back to your usual way of eating. But overall, it is safe to consume the meals for prevention even after you've had a cancer diagnosis.
Could I just add as well? I think Melissa's like really lovely covered and summarised all of that. But it's just to reiterate that for secondary prevention, it's much harder than preventative sort of following that diet advice, because often people have symptoms from the cancer itself or the cancer treatment, which Melissa was touching on, and it's really important to get that support to help implement some of those diet a stoma fitted or something like that, getting advice to increase that fibre, because that is really important. And sometimes we do have sort of like blanket advice of to not have fibre when you have a stoma, but it is really important to get individual advice from oncology dietitians to help bring up that fibre. That's just an example, but there's many more throughout, individual cases with different tumour groups and different side effects from the treatment itself or from the cancer.
Thank you very much. There was a part of a follow-up question there, but I think you've incorporated that in your answer. But if there's anything else you wanted to add, are these also the same advice that you would give for someone preventing cancer developing in the first instance? And I think you've said that it's very similar advice, but that you have to tailor it for the extra. But just in case there was anything else you wanted to add there.
Yeah, I'll just add that. Yeah, I'll just reiterate that. Yeah, so it is the same. The recommendations are the same for prevention and survival of cancer. Like was mentioned earlier, it does depend. If you have had a diagnosis, you may struggle with fiber intake. Some people that are living with certain head and neck cancers can't eat pineapple. But again, the advice is to, unless otherwise advised from your healthcare professional, then you can start to follow the preventative measures in terms of dietary advice for people who are living with and beyond cancer.
Lovely, thank you. That's a good amount of information there for prevention and secondary prevention to prevent cancer occurring. However, for people where they have got a diagnosis of cancer, there's also a huge number of questions. The topic that we got the most amount of questions about was in relation to sugar. So we're going to look at that first. And there are a lot of similar questions. So I've just pulled out a few that represent hopefully what people said in general. So can lowering sugar intake reduce the growth or spread of cancer cells?
So I'm happy to start on this question. So I think, like you said, there's a lot of questions often around sugar. So I thought a helpful place to start might be just explaining how the body uses sugar initially. So sugar comes in lots of different forms. So the most simple forms are single molecules of sugar. So that would be things like glucose or fructose that you might have heard of. These simple molecules then start to stick together. So for example, a glucose and a fructose together make a sucrose, which is table sugar. So that kind of white sugar that everybody knows that you sprinkle on things. Combinations of those different molecules start to stick together a bit more and make up more complex sugars, which then form things like carbohydrates. So as they start to stick together, they lose some of that sweet taste. So those then become things like pastas, potatoes, rice. Our body's made of millions of cells. Each cells have different jobs, so kind of muscle cells, nerve cells, all doing different things. But ultimately, the thing they have in common is that they use glucose for energy. So they break down glucose in order to do that. So if we eat and drink things that are high in glucose or simple sugars, such as fizzy drinks, sweets, that glucose gets absorbed straight away and is ready to use. But if we are having it in more complex forms, so the starchy carbohydrates like pastas, potatoes that I mentioned before, then enzymes in saliva and digestive juices actually break it down and convert it into glucose, because that's the form that the body uses for energy. If we did reduce those carbohydrates or cut out sugar, then actually the body would have to use fat and protein molecules to make glucose as a last resort, because all cells need it to survive. So I think the first time that cancer and sugar kind of get a little bit intertwined is that cancer cells that are solid tumours are just lots of cells multiplying really quickly, so multiplying more than normal cells, and that requires a lot of energy, which requires a lot of glucose. So there's some suggestion that actually if we then stopped feeding the body those things, that would that then prevent the cancer from being able to grow. But unfortunately, it's not that simple, because there's no way of telling the body not to feed the cancer cells, but to continue feeding the healthy cells. So actually, we'd be damaging the healthy cells as well. And also the body, as I mentioned, even if it doesn't get the carbohydrates or the complex sugars, it will still use protein and fat in order to produce that glucose. So that's often a reason people can lose weight, because it starts to break down whatever stores it needs in order to use that energy. So actually, it can be quite damaging to the body to cut those things out, because you start using stores of other things, and carbohydrates, as Rachel mentioned, should be a quarter of our plate to provide us with some of the energy that we need. And particularly during cancer treatment, you need that energy to get through treatment. So ultimately, no, unfortunately, cutting down those things doesn't help stop the growth or spread of cancer. Hopefully that's a helpful kind of starting point.
Thank you. In relation to that, someone asked, to what extent should I be avoiding sugar?
So I can perhaps come in on that. I think I gave a really good summary of how sugar works and why there is potentially this myth around sugar and cancer. The crux obviously is that both cancer cells and healthy cells use energy from the same source, so you can't starve one without starving the other. But in terms of sugar in general in a diet, you don't need to cut sugar out completely. Some people do end up eating or drinking a lot of sugar, and that can make it harder to have a healthy weight. So it is, and there I'm talking about, your simple sugars, so added sugar, and the sugar that we know when we say the word sugar, I guess. So yeah, if you're having a lot of that, then certainly that can make it harder to keep a healthy weight. And as Melissa covered so well before, that does impact the risk of cancer. So we do encourage people at Cancer Research UK to reduce their consumption of high fat, salt and sugar foods just in general, because it is good for your overall health and your overall ability to keep that healthy weight as well.
Lovely, thank you. I think those answers together hopefully answered the sort of slight variety there of questions that we had that were on the topic of sugar, so people feel confident to make those decisions there. So we're going to look at move on to something slightly different, and this was also something that were quite a few questions on. So what role does the gut microbiome play in cancer prevention?
So I'll take this one. So this is such an interesting and emerging area of research currently. So when we look at it, we know that specific microorganisms such as H. pylori do increase our risk of cancer. So that's been proven for quite some time. But there's less certainty when we start looking at causation and the overall human gut microbiome. So if we start looking at the evidence, so obviously it always starts with in vitro and mice studies. So looking at those, they are starting to identify some plausible mechanisms in the gut microbiome and causation of cancer. But the big question we want to know is around why do sort of some individuals, some people who have similar lifestyles and are in the same age categories get cancer while others don't. For this sort of proving, we need like longitudinal human studies. We need to understand what that causation is. So expert opinions are starting to come out around that genetic and environmental factors alone. So sort of when we think of it, our genetics, and we know the DNAs, environmental, sort of where we live, but also our diet and lifestyle, they don't fully explain why some people get cancer and others don't. So this is where we're turning to that human microbiome may have an important sort of cofactor in deciding the risk of our cancer or getting cancer. Sorry. So we know that there may be some sort of causal, but how does diet play a role? So we know that diet influences the gut microbiome. For example, there's been ample studies showing connection, and later on, I think there's some questions around the ketogenic diet. But if we look at that and how that affects the gut microbiome, there's been studies that have shown that people that follow a ketogenic diet have a less favorable gut microbiome, and that following that diet alters their gut microbiome while they are on that diet. Is likely due because they're reducing their fiber, and we know that fiber flourishes the gut microbiome. So we'll talk about probiotics and prebiotics. So prebiotics, we are, our fruits and vegetables. We need those to sort of prep our gut in essence for probiotics, to be absorbed or sit in the gut microbiome. I could talk for ages. We're obviously born with a sterile gut, and we influence it from the moment we're born, and that starts the flourishing our gut microbiome. There are obviously studies around fecal transplants to alter it, and we can start trying to adapt it through diet. So what would I say? I would say follow a healthy, balanced diet, as we're all sort of saying anyway, including fiber. Everyone is saying lots of fiber in this talk, plenty of fruits, vegetables, like beans, pulses, whole grains. If you want to include some probiotic foods, fermented foods, kefir, kimchi, sauerkrauts, kombucha, live yogurts, all of those sort of foods. Definitely a good idea to start including some of those in your diets. Limit sort of like alcohol, which we know influences the gut microbiome as well. And I think someone's talking about that later or answering some questions on that. In terms of probiotic supplements, I would generally avoid these unless you have sort of had individual advice. There's just so many different strains of probiotics out there, and different ones would affect different sort of symptoms or for different reasons. So if it is something you want to try, definitely maybe after having high dose antibiotics, it might be a good idea to have probiotics. There's nothing you shouldn't be able to do through a sort of balanced, healthy, regular diet with some probiotic foods in. If you do want to take probiotic supplements while on treatment, it's definitely something you need to talk to your oncology team about. As there sometimes are contraindications with treatments that you may be on. So overall, healthy, balanced diet, and talk to a professional if you want to take probiotic supplements, as it will sort of be individual basis.
Thank you. It's a really interesting area, isn't it? I think it's one that even in 10 years, we're going to be looking at slightly differently, because there's so much new information about feeding the bacteria in our gut as well as our bodies.
Yeah, it's so interesting. And also around tailoring, like getting someone's gut microbiome, testing it and tailoring the treatment or anything to that. I mean, I think we're quite a while off, but it's really interesting to start seeing the evidence coming through and using it for that, and that personalized care will be play a role in.
But it is helpful that the advice that what your gut microbiome likes is also sort of ties in with the general healthy eating advice and what's already been mentioned in terms of prevention, isn't it? So here's another question. Is there a link between processed foods and cancer?
I can go ahead and speak about that question. So I mentioned a bit about it earlier. So we spoke a lot about processed meat specifically, but in terms of processed food, what's the link between cancer? So it's mainly around the nutritional density of these foods. So processed foods tend to be high in energy, often high in calories, salt, sugar, saturated fat, and lower in minerals and vitamins and minerals like fiber and things that we've spoken about that's useful towards preventing cancer. So in this sense, it can easily increase your energy intake, which could lead to excess weight, and that has been associated with cancer. So in terms of processed food specifically, yeah, it's not necessarily ideal to have a diet that's high in processed foods, as that not only is it not giving you the optimal nutrition, but it's also increasing your empty calories and excess calories, which then can lead to excess weight, and that could lead to up to 13 types of cancers.
Thank you. So a lot of it is about that you get full up on these foods that don't give you so much of the good stuff, as opposed to them being bad. It stops you then eating so it's more about making sure you've got the good stuff in than avoiding some of those extra.
Yeah, exactly. And even with being full, it's like you find that when you eat lots of like high processed food, you don't actually feel like you ate a real meal. So lots of people have snacks in between their meals and don't necessarily realize how calorific these snacks are and how low in nutrition they may be as well. And then they'd eat a meal on top of it. So now they're having excess calories, and then that's what could lead to the onset of cancer, or at least increase the risk of up to 13 types of cancers.
Thank you. And then also on the ultra processed foods topic, there's a lot of buzz around ultra processed food at the moment. It's quite a broad question, but how do we make whole foods more accessible to people from every socioeconomic bracket?
I think that's a great question. So when we speak about ultra processed foods in comparison to processed foods, ultra processed foods, again, quite similar. So they would be things like biscuits and things that have just been industrially processed and factory made, and high in salt and sugar, often very addictive. So these types of foods. And in terms of making whole foods more accessible to every socioeconomic background, I would say it would be more about the understanding of what a whole food is. So you find that in the health industry, different buzzwords come up every now and again, and it can confuse the public as to what does a whole food mean. Does it mean organic? Like, people tend to get certain things mixed up. But I guess it's more about letting people understand what a whole food is. Essentially, it's fruits and vegetables, things that have not been extremely processed, such as fruits and vegetables and whole grains, lots of the foods that we've mentioned earlier. And so once people have that understanding, then the accessibility to those foods become a lot wider. And then also understanding how the types of forms that they can come in. So there was once a campaign about fresh food being the best, but that has since been debunked. It's important to have all kinds of foods, so fresh, frozen, tinned, they all count towards your 5 a day, not just stressing that everyone should just have fresh foods, but all kinds of foods. And then I would say, think about things like storage. So you find that when someone's trying to increase more fruits and veggies into their life, they tend to find, well, especially like me, if you don't eat so many salads and you buy it, you find that it stays in your fridge and it ends up going off. But then if you speak about storage options with your patients or clients, you find that there are varieties of ways you can keep fresh food fresh, or you can keep food edible for long periods of time. So things like keeping a variety, different types of foods, storing them in your fridge, in your cupboard, in your freezers, and exploring different ways that you can have different whole foods in different forms available to you. I'd also say it's important to be creative and be diverse. So don't just focus on the foods that are just around you. Try to get foods from different types of sources, and try different types of cuisines as well. You'd find that the more you experiment with different kinds of whole foods, you increase the access to it, you increase your access to having these nutritious whole foods. And then you might find that some foods are more budget friendly than others, and it gives you the opportunity to actually keep those budget friendly foods at your repertoire and keep them have access to those types of foods. So yeah, so that's what I would say in terms of increasing access to whole foods and reducing the intake of ultra processed foods.
I'd love to add to that as well, Melissa, because I think you gave some amazing practical tips there that a lot of us can go away and think about for ourselves. We're giving a lot of information in this webinar, full stop, really, and it can be kind of overwhelming. But I think it's important to say that it's not just, sharing this information and being aware. We also rely on our government and our policymakers to be making the changes that make having a healthy, balanced diet something that's practical, affordable for people, an easy option, an appealing option. And food poverty does exist in the UK, and it's something that we need to keep fighting against, because if if someone can't have a healthy balanced diet, it doesn't matter how much they know about it, they're not going to be able to go forward and do that. But I really like there what Melissa said. You know, some of those options, canned foods in particular, are much more accessible for people. They can be cheaper ways of getting things like fruit and veg into your diet. So there are options and there are workarounds, but it is also important that we look to policymakers to make those healthy changes easier for us all.
Lovely. Thank you both. So earlier, it was briefly mentioned about ketogenic diets, Vicky mentioned, but further to that, a bit about fasting. Will fasting during chemotherapy improve the effectiveness?
So I'll answer this again. So if we look at sort of how fasting's come about, we can see in the media it comes in when we start talking about like healthy eating and weight loss, and sometimes it's termed to like reduce cancer risk as well. But it's quite niche and new around sort of fasting around our chemotherapy cycles during treatment. So again, looking at the studies, it's very early data. A lot of it's still in vitro studies and animal studies, and there are a small handful of human studies, mainly in ovarian and breast cancer. So I will talk about these, but it's just worth noting that obviously the findings of these are really small groups, and obviously it's only in breast and ovarian, so you can't. It's very difficult to sort of draw comparisons to other tumor groups. So when we look at that evidence, there are some positive outcomes. So when we talk about fasting as well, it's short-term fasting, but some of the studies range from anything from 24 to 120 hours of fasting. Within this also, some studies say no energy intake, so no calories whatsoever, and other studies allow small amounts of energy, sort of from broths and small intakes of other small calorie liquids. So it's really difficult sort of to define what the studies are looking at with fasting and what they define fasting as. But some of the outcomes from the studies have shown that there is increased treatment tolerance. And there's also reduced chemotherapy related side effects. There's reduced fatigue, and there was reduced GI symptoms, so less bloating, less diarrhea, less constipation. In some of the groups as well, and some of the participants also reported improved quality of life. So it all sounds really positive, but the problem here is it can also be dangerous as well, and this is where we have to be careful. So these studies didn't include anyone with a low BMI. They didn't include those that had recently lost weight. They didn't include people with diabetes or heart disease or eating disorders, because obviously, if a lot of people struggle with eating during chemotherapy from the side effects themselves, and we know that losing weight in someone's self also increases as side effects. It will result in reducing chemo doses, which reduces effectiveness of chemotherapy itself. So again, there are sort of some promising results, but it would be something that I would only recommend if someone brought it to me. I don't think I would even say recommend. It would be maybe something, it would have to be very like one-to-one with a lot of support. Maybe watch this space. More studies need to come out, more human studies need to come out in different tumor groups. If it was something that someone wanted to do, they would need a lot of support from an oncology dietitian during their chemo, because the main thing is we don't want them to lose weight. Muscle mass is really important during chemotherapy, and we know that. So it would be, again, very supportive and tailored advice. And it would require the health professional and the person affected by cancer to work together very closely. But as a general rule of thumb, I would not be recommending this at this moment in time, with the lack of evidence and the side effects of sort of concerns around weight loss. And also it's worth noting that those that did manage to fast reported a number of side effects of headaches, hunger, weakness, nausea, lightheadedness, alongside the most important one, which was obviously weight loss. So it could only be done in those that were a healthy weight and very fit in the first place. So sort of a summary.
Thank you. It's a lot of information there. So similar to the fasting question, there's another question. There's increasing comment on social media about a ketogenic diet and cancer. Have you any comments? So for people that aren't familiar, a ketogenic diet is a diet where people avoid carbohydrates so that their body produces something called ketones as a response, as a different fuel for their cells. And well, I'll let you answer. Who would like to answer?
Yeah, I'll take that one as well. So again, it's really interesting, and sort of the ketogenic diet got a lot of popularity in 1911, actually, when it was first came around for child epilepsy. And it's still used sometimes as a treatment for that. And then in more recent years, it's become popular in those affected by cancer. And as Laura said, it's around cutting out carbohydrates, forcing the body to use ketones as its energy source, which in turn reduces that energy production of cancer cells, or that's the theory, that it reduces energy to cancer cells, decreasing tumor growth. But we know from when Claire was talking about sugar, we know that isn't the case, because there is no way of making the tumor cells only, tumor and normal cells not feed off sugar together. So what is the keto diet again? So you obviously know by now that I love looking at the scientific evidence. So if we look at it again, the research cannot define what a ketogenic diet is. It varies. It's really important that we talk about the macronutrients, which is fat, carbohydrates, and protein. So when we look at the research, they all have different percentages of the macronutrients as your energy source. So we have fat intake in the studies ranging from 10 to 30%, and protein ranging from 4 to 20%, and the rest is made up from the fats. So it's really varying in the evidence. So when we look at it, there was a lovely report done by a dietitian that looked at all the reviews, and they said that a lot of people that tried to follow it, they lost weight. There was no sort of consensus around if someone was ketotic. They also struggled with fiber intake. As I said, the microbiome was changed. That wasn't from this review, but from another one. So because of this lack of data, to support it, it also showed that tumor growth was not affected. The tumors either stayed the same size, but it definitely didn't shrink from following a ketogenic diet. So we know following a ketogenic diet doesn't shrink the size of a tumor. We know there's side effects of constipation because of the lack of fiber. Some people reported really bad breath as well because of the ketones. There's no way of knowing if someone is ketotic fully. And it will vary from individual to individual what percentage of fat they need to have, or reduce the carbohydrates to make them ketotic as well. So therefore, at this moment in time, with all that evidence, it wouldn't be a diet that we would be recommending to sort of reduce your the size of your tumor, as there's just no supporting evidence.
Thank you. It can also be a very difficult diet to follow, can't it? So if you're having chemotherapy, you've got the diagnosis of cancer, all of those things as well. It's another sort of hardship to put on yourself to do.
Not very palatable to be sort of eating. butter.
Lovely, thank you. I just been having a little look at the Q&A that people have been typing through there, and they're just going to nip back to the ultra processed foods, because there was someone asking for a clarification, saying, I think with this question you mean ultra processed, not processed. Please, just to be clear on that when we were talking about the ultra processed foods, because something like mincing meat, or I mean peeling a carrot, in a way you're processing it, aren't you? Chopping up mashing potato, that is processing, and we don't mean that, do we? We mean things that, I don't know if anyone wants to speak on that at all.
I don't mind jumping in. Yeah, I mean, it is confusing, and I understand that. And one of the difficult things is it's not just confusing to the public. The research can be a little bit confused in the fact that people use slightly different definitions sometimes for ultra processed foods and what they mean by that. Broadly speaking, ultra processed, like Melissa mentioned a little bit earlier, is things that have kind of been processed almost sort of beyond recognition. So you're not seeing the ingredient anymore in that food. So it might be, something like, let's say salami, or something that's, very much changed from its original form. Whereas processing, that can mean any number of things. And it is difficult for people to know. What I would come back to, though, is that so far we don't have good evidence that there's a direct link between ultra-processed food and cancer. So if that can help to reassure people that, yes, ultra-processed foods are a problem because they can take the place of healthier options in our diet, but people don't need to kind of demonize them or feel like they have to completely cut them out, if that would be too difficult to do. It's more about, again, thinking about the diet as a whole, and coming back to that.
Thank you. There was also a query, I don't know, Melissa, you mentioned a couple of times about the 13 different types of cancer that can be increased, whether you have a list of those, either to pop into the Q&A response there for people, or if you have it there to...
I think I did add that, Laura, to one of the
you?
answers already. Yeah, there's a web page on the CIK website, and that has the full list there.
I haven't looked back at that. Thank you. So that information should be there in the Q&A for people, and we can add it when we circulate the links and things afterwards. Lovely. So what is the advice regarding, so there were a few questions, some a bit more specific about alcohol and breast cancer. This is more general to cover what is the advice regarding alcohol and breast cancer.
Yeah, great question. Hopefully no one's getting bored of my voice yet, because I'll come in on this one if that's okay. So yeah, it's really important that we talk about alcohol when we talk about diet, because it's obviously one of the things when we're talking about food and drink that comes in. Alcohol is a cause of 7 types of cancer, including some of the most common types. And we do encourage people to think about how they can reduce their alcohol intake. So that for some people might mean cutting back. For others, it might mean cutting it out completely. It doesn't actually matter how you drink alcohol or what kinds of alcohol you drink. We often get questions of, oh, is it better if I spread out my drinking across the week? Or is it better if I drink, certain types, maybe red wine? Is that better than beer? Like, what's going on there? All that really matters when it comes to alcohol is the amount you're drinking. So by amount, I mean the units you're drinking. So reducing your units, however you drink, whatever pattern, whatever you drink, is going to reduce your risk of cancer. So it is something that we do encourage people to do. I would say here as well that 1 in 5 people in the UK actually don't drink alcohol at all. So, it's not uncommon, and we are, as a nation, sort of moving in that direction. I do recognise that it's not always the easiest thing to do. If it's been part of your life for a long time, it might be part of how you socialise. But we've got lots of really good tips on our website for people to explore, and perhaps I can drop a link, or Laura, you can share one afterwards. Things like cutting the size or strength of your regular drink, or swapping your usual drink for a low or no alcohol alternative. It might be, you're trying to keep some days of the week totally alcohol free, and gradually increasing those days. So there's lots of different ways you can go about it. For people who are struggling and are really thinking, oh, like, I'd like to do this, but I've tried for a while and it's not quite working for me, you can talk to your GP as well about other methods. So yeah, those are our general messages about alcohol, but it's a really important topic, so I'm glad it's been brought up today.
Thank you very much, Rachel. So then what about when people are having treatment and things in relation to the treatment? And we know that there can be lots of different side effects from cancer and from the treatment of cancer that can make it more challenging for people to meet their nutritional needs in the way that they usually would with their usual food and drinks. So there are various questions in relation to that. The first I've got here is, when appetite is low, what is a good choice of foods to choose? Who would like
Oh,
to take?
sorry, I was trying to say I'm happy to answer that one, but I couldn't get off mute. Obviously, different cancer sites have got lots of different side effects, different ways that you might be feeling. So hopefully I can just give a bit of an overview into helpful things in terms of the low appetite to start with. So some of the general advice that we would give to patients that we might be seeing on treatment is a lot of people are still kind of eat 3 meals a day. So trying to think about turning that into 5 or 6 smaller things is a good first step. And so I know we've talked a lot about kind of processed versus ultra processed. And one of the reasons it's good to emphasize that actually some of those things have got a place is sort of easy, ready to grab snacks that are energy dense are good choices. So things like fruit and nut mixes, nut and oat bars, yogurt pots, boiled eggs, cheese sticks, kind of fortified drinks can be helpful. Sometimes if you're finding that eating is quite overwhelming, so often when you haven't got an appetite, even cooking foods and smells and seeing foods on plates can be overwhelming. So can you think about replacing some things with nourishing type fluids? So milky drinks or milk alternatives can be really helpful. And also we think about what we call fortifying meals. So where you're having tiny things, can you make them as sort of energy and protein dense as possible? And I think one of the questions in the Q&A was, can you kind of fortify things and make them energy dense without making them seem unhealthy? So yeah, so thinking about fortifying with unsaturated fats. So that can be things like adding extra olive oils to things, even things like avocados, hummuses that are made with olive oils that are energy dense but in unsaturated fats. But also to emphasize that particularly on treatment and when side effects would be sort of slightly shorter lived, is to not worry about having those things for that short time period, because a lot of those kinds of foods, and you see the negative effects if you were on them for a long period of time, but in this short time frame where you need to get the energy and the protein in, it's okay to rely on those foods during that time. Avoiding things that are sort of as we call kind of clear fluids or clear soups, so things that are empty in terms of calories, protein. So where you're thinking about, again, fluids or meals, making sure that everything that you do have has got some kind of nutrition in it. And also if drinking makes you feel full, so spacing that out from your meals so you're not filling up too much on those meals. There's lots of, again, in the resources that we'll share at the end, there's lots of helpful low appetite resources, and it talks about, again, sort of an even better list of the high fat things. So again, your vegetable oils, nuts, seeds, avocados, and fish can be really helpful. And then focusing on protein as well, so protein-rich foods. So again, it doesn't need to be things like meat-based products. It can be pulses, beans, chickpeas, lentils, even things like tofu, soya, eggs, milk, and cheese can all be really helpful foods to focus on. Hopefully that helps a little bit.
Lovely, thank you. And I think there's some resources on the NHS website, and so we can include some of those in what we share around as well. So another question, what is the best diet for patients who are going through chemotherapy, especially when they've got no appetite? So that's similar to the other question. Was there anything else to add on that one?
So I think, sorry, I kind of incorporated them both together, but I think the resources are probably the most helpful thing to send after as well.
Yeah. And sometimes just every little bit counts, isn't it, as well? Just going for whatever you fancy and able to get in, even if it's like something you used to eat when you were a child and you haven't eaten for a while, it can be good to rediscover these things. So another question, what can you eat when you have a compromised immune system during treatment in relation to live foods such as kefir?
Okay, so we've had a look at all the sort of research around this area, and the kind of main thing to say is that there's lots of small studies, but unfortunately there's not enough sort of significant findings from those studies to really make a clear recommendation about this. In some of the small studies that were done, they found that people experiencing diarrhea on chemotherapy or experiencing diarrhea on radiotherapy felt better if they were taking probiotics, so they had less incidences of episodes of diarrhea, or they maybe needed to use less medication to help manage their symptoms. But unfortunately, because of the sort of small sample sizes that tended to be used, we're just not able to kind of make a recommendation on the back of that to our patients. And when you look at different advice from different cancer centres, we're all kind of saying vaguely similar things. So generally, as a bit of a rule, the sort of things you can buy in the supermarket, like live yogurts, probiotic drinks, are all, relatively safe on treatment. But it's more the kind of higher dose probiotic products, things that are that you might buy from a pharmacy, for example, in capsule form, that we would advise caution with, because we just don't know if you're immunocompromised, what effect that might have. And we've already heard from Victoria about, your gut microbiome and what things are affecting that and the damage that chemotherapy can do to that. So at the moment, I think, as I say, just sort of using the stuff that you can buy in supermarkets or things that you use anyway are fine, but just maybe not going too overboard and just following the advice of the nurse specialists that are looking after you on treatment.
Excuse me. Thank you. Can you explain why some patients are told not to take certain vitamins during cancer treatment?
So again, I'm happy to answer this one. There are certain chemotherapy regimes where if you are using vitamin and mineral supplements, they can actually make you more sensitive to the chemotherapy. And you might actually think, oh, that's a good thing, it's going to work better. But actually that can mean that you might experience increased toxicities from the treatment. So you may be advised, particularly if you're following a regime that includes drugs such as 5-FU or fluorouracil, to avoid any vitamin containing products. Similarly, if you're also taking part in a clinical trial, you might be asked to avoid vitamins and minerals because the trial, they might not be aware of all the interactions between the vitamins and minerals that you're taking and the new trial drug. But also they want everybody who's taking part in a trial to be sort of at a similar kind of standard, if you like, so that nobody within that trial has got sort of a different set of conditions to the next person. So again, it's just sort of working with your pharmacy that you're seeing while you're on treatment to make sure that you're declaring any supplements that you're taking, because there's lots of other alternative supplements that people may use which can also interact with your treatment. So just being quite open and honest about what you're using is great advice. And if you're advised not to take vitamins and minerals, it's because there's probably risk of harm.
Thank you. And it's generally discouraged to what we call megadose vitamins as well, isn't it? So, 100% of what you need or a little bit more. But if you have kind of 1,000% or something of what you need, then that can help. That can sort of interfere with other compounds and things.
Absolutely. And they tend to be quite expensive, do a lot of these kind of megadose products. And quite often with some of them, you're literally just peeing them out again at the other end. So, they're not beneficial in any great way. So again, working with your dietitian if you've got one, and again, following the advice of the pharmacist that's working with the specialist chemotherapy team.
Lovely, thank you. Have any tests or research been done to ascertain whether any particular foods are important to aid the healing of cancer or to affect significant changes to the health of the patient?
Again, I'm happy to just jump in on this one. I think the kind of biggest area of research in the last few years has been around sarcopenia. So sarcopenia is low muscle quality and low muscle quantity. And that's something that people can have before their cancer diagnosis because they might be inactive or they might have a poor diet. But it's also something that can develop during their diagnosis because of the impact of the cancer itself on their physical activity levels and their oral intake. And also the added addition of side effects from treatments. So a big area of sort of new research is around high protein diets to try to provide the protein that's needed to maintain muscle mass, but in conjunction with that also increasing or maintaining that physical activity level so that you're maintaining the muscle mass that you've got. And we know that people with sarcopenia, they have poorer outcomes from their treatments. They have longer hospital stays if they have cancer surgery. They have sort of slower recovery times after cancer treatment and cancer surgery, and they have increased rates of toxicity from their treatments. So if we can do anything to prepare patients prior to them starting chemotherapy or in preparation for them starting whatever cancer treatment it might be, radiotherapy or surgery or immunotherapy, then following prehabilitation advice, which is basically good preparation of people prior to them starting treatment, can be hugely beneficial. So much evidence emerging around that all the time. And ideally, in your area, you might have access to a prehab program, which might be sessions or classes that you can join in order to achieve that. Up in Scotland, we've got a web-based resource for patients that they can access to get information about that. Just depends kind of where you live, what's available in your area, but there's great resources, some of which we're going to share today, about ways to increase your protein intake and also around prehabilitation.
Lovely, thank you. So we're lucky to have 3 excellent oncology dietitians on the call today, and there's lots of oncology dietitians across the country, but not everyone does have access. So there's a question in relation to that. A lot of people living with cancer do not have direct access to a registered dietitian via the NHS. What is your advice for accessing a registered dietitian when patients have queries or concerns about their diet?
So again, there's a couple of different ways that you can do that. First of all, you can perhaps be screened. So there's what we call malnutrition screening, which is where maybe when you have your first contact with a hospital outpatient department or a treatment area, hopefully somebody is undertaking some nutrition screening, and that would flag if you're high risk, and therefore that would result in referral to a dietitian. If you know that's not happened, you can undertake self-screening. So we're going to share the link today to a website where you can undertake a particular nutrition screening tool that will flag if you're currently at risk of malnutrition. And again, you can then go to your GP or your healthcare provider and be able to say to them, I'm at risk of malnutrition, I need to see a dietitian, and then hopefully they'll be able to refer that on for you. But there's lots that you can do to be preventing malnutrition. So if you know you're already starting to struggle, but perhaps you're not scoring enough on that screening tool, you might be what we call low risk of malnutrition, then again, there's lots of things you can do, as Claire described there, in terms of fortifying your food, maybe sort of eating more little and often snacking more in between meals if you wouldn't ordinarily do that. Things like drinking a pint of milk if you like to drink milk, because that's straight away 400 calories and a good amount of extra protein. So it's just thinking about, am I going to head down the road of developing high risk of malnutrition, and what can I do? What steps can I put in place to prevent that from getting any worse? And in addition to that, remembering the bit about sarcopenia as well, because that's just as important. So maintaining that physical activity level and making sure you're achieving your protein requirements.
Just to add to that, sorry, there are other organisations that do exist to try to increase access to oncology specialists as well. So I would say to also reach out to different cancer charities and public health charities who do have PrEP programs where they are led by oncology specialists, and they provide options for additional support, even if you're going through living with cancer, or even if you just have a question about it. So don't be afraid to get in touch with other organizations and charities, and even if they're not offering the support that you need, don't be afraid to suggest it, because charities and public health organizations are always looking for a need. So if there is a need for access, then feel free to reach out and ask them if they're able to provide that type of support. But like Helen said, in the resource list, there is quite a few links on there that can help to provide access to more of the type of support that people need.
That's a great shout about the other charities. So for example, Pancreatic have webinars specifically about diet, and they have a helpline that you can phone and contact dietitians, and there's other cancer charities that offer things like that as well. So yeah, absolutely explore all the options to get the help that you need.
I
Sorry,
think
also just to interrupt, there's also in the resources, I think Laura will include the Cancer Care Map, which is just a website where you can type in sort of like your concern and your area, and it will give you your local charity, and that can help with that. So you don't need to know all the individual charities, you just write in your concern, your area, or even if you want remote. So again, a really useful resource just to identify who could help you if you're not sure.
Thank you.
I think building on all of that even more, so I know definitely in Cambridgeshire and some of the other areas that often with hospitals that are associated with migraine centres, so a lot of dietitians actually work in different places like that, or we actually do some talks at our local garden centre. So you get access to an oncology dietitian in a group setting, and that can be really helpful. So speaking to, if you've got a specialist nurse, they should have details of any support groups that are happening, and after they're cancer site specific as well. So that's really helpful. So you kind of get the right dietitian delivering the right information. So that can be really helpful. So speaking to your specialist nurse about any support groups that might be happening in the area as well is really helpful.
Thank you. So between all of you, there's lots of different options there. And I think that sort of maybe collectively the message is to ask and to keep asking. And like Melissa said, people need to know the need is there, and maybe there's an unmet need to grow services as well. So feel empowered to ask if that's something that you think would support you in your cancer journey. Thank you. The panelists have been answering by typing a lot of the questions that have been coming through while we've been talking, so that's brilliant. I'm just going to pick up in that I've seen there's quite a few different people have asked about dairy, so I want to try and answer that live so that everyone could hear. So is there a link between dairy products and cancer? There's and cancer, that's the most general one, I suppose, there.
Yeah, thanks, Laura. And I'm glad that the attendees have picked up on this, because it's been quite a popular topic recently. There's been a few news stories about dairy and cancer. So it's a good opportunity to address that. So I want to be totally clear, eating and drinking milk and other dairy products, it can reduce your risk of bowel cancer. So often we hear about dairy in more of like a myths context. Can it cause this cancer or that cancer? But actually it's the exact opposite. Good quality studies have shown that it can reduce the risk of bowel cancer. And that's thought to be, it may be in part through the dairy itself, but it is thought to be mediated a lot by calcium. So that's really good news for people who either choose not to have dairy or can't have dairy in their diets, that the calcium content is thought to be the main sort of driving factor for that reduction in risk. So having diets that have enough calcium in them, whether or not that comes from dairy sources, is a good thing.
Thank you. I also just noticed someone put in the Q&A a comment that might be useful to the last question, just to share with everyone, that the World Cancer Research Fund have got a hotline number where you can also reach an oncology dietitian, and that's a free number. I don't know the number, but that's a little bit extra there that might just help someone on that last question.
So I don't know if we also just wanted to go back to the dairy and just talk about it in terms of secondary prevention around breast cancer as well. I don't know if anyone has any sort of like more knowledge in the panel on it, but there's also evidence around like following not following, drinking like or eating low fat dairy as a prevention for breast cancer. So not full fat dairy, the lower fat dairy. Again, I'm not 100% sure on the links of it, but the evidence is more around low fat dairy for reducing secondary prevention of breast cancer.
Wonderful. Thank you. I mean, I think what we're experiencing from this and all of us through our professional lives as well is that it's complex. It's not like a drug that you can take that's one pill that's controlled. You know how much is in that, how many times you take it a day, a week, or whatever. But there's so much in our diet that's influencing, and we're discovering more and more each year. Okay, so in terms of the information and things that people receive, one of the questions we've had is, how can we best get the right messages out there? Today is an example of how we're trying to share some of the good information. What other thoughts do you have?
Great question. I think use everything available to you. If you're confident in that you're sharing evidence-based information, then yeah, we need your help. And equipping other people to find their own information is a really key thing. So talking to people about how they can find reliable sources of health information. So an example is you can look for a quality standard that's called the PIF tick mark. So that's on things like the NHS website, on Cancer Research UK's website, and that's a really good indication that that organisation has followed evidence-based processes to develop their messaging. So that's something we can tell people about. People sometimes have questions as well about how much to believe in terms of newspapers and things coming out in the news. Newspapers need to be really bold with their headlines to get our attention, to sell us things, to keep us on the webpage long enough that they can, convince their advertisers to keep sponsoring them. And the other side of the coin is that researchers need to create impact to get funding to continue their research. So you kind of have this cycle of people kind of bartering for attention. And that can sometimes confuse the picture when it comes to clear health messaging, what we need. So what we tend to recommend at Cancer Research UK is when it comes to newspapers, people look past the headline. The headline is a very word-limited piece of text, and actually in reading the story you might find that there's nuance in there that the headline didn't convey, but also looking for experts. So experts are often quoted in better quality reporting, and that could be us, that could be the NHS, it could be oncologists, it could be the researcher themselves, and look to see what they say. And also, and this is the most important point, is to compare back to what reliable information sources are saying. So if you read something or you see something on social media, going back to where reliable information is on the Cancer Research UK website or the NHS website, and if it doesn't say it there, or if it says something different there, then you can start to really question that and what you're seeing.
Yeah, and just to add to that, I would also say, like you said, we're doing today, Laura, working in partnership. So you tend to find that there is, the same messaging across credible sources. So you would find that, unifying aspects if the information, if it's a credible source. And I would say to not be afraid to get involved. So like I mentioned earlier, don't be afraid to get in touch with, your health professionals, ask for advice, or get in touch with cancer charities or other organizations. Don't be afraid to get involved and let them know that you're querying this, or can you lead me to the research that supports this. So the more we have involvement from patient advocates, the better. And I'd also say don't wait until you are affected by cancer to understand the messaging. So a lot of the time when you are living with cancer, it tends to be a difficult time. You may feel quite desperate, you may feel quite defeated, and you are more likely to accept misinformation, or more likely to at least try it because you're in unfortunate circumstances at that present moment, and you are more vulnerable. So if you are in a situation where you haven't got cancer, or a loved one has cancer, take the responsibility and try to share the right messages so that if it does happen in future, you're already prepared for it. So yeah, so I'd say get involved with organizations. Don't just leave it to the health professional to share the information. It's everybody's responsibility to help to make cancer as survivable as possible.
Thank you. I think that's really important, isn't it, to think about like who might benefit from some of the information as well. Sometimes, like you said, people want to just say something interesting that other people want to read and like and things, and that might not be the healthiest message for people. And also that people who have cancer or their loved one has cancer are in a very vulnerable position, and it's totally understandable that people want to do whatever they can to help themselves or help their loved one, and sometimes that can be exploited by people for profit, which we want to obviously avoid. We want people just to get good information that they're actually going to benefit from. And there is a kind of phrase sometimes used that we want to treat the person as well as the cancer, you know, and so nourishing someone's body and is important, as is giving food. And people give food, it's something that we share as a bond with the people that we care about. It's a cultural thing. It means a lot more than just the nutrition it's giving us, and that can also be quite difficult for people's families when that's not accepted. You know, if you make someone's favorite meal, you normally get a lovely response, but if they're not well enough to enjoy it, then that can be quite difficult and feel difficult for the person that's made it for them. So actually that might be something else that they could do, like Melissa said, to look at the research and see what other options there are. Okay, so there's another question linked to that. Why does the panel think there is so much unscientific reportage available in the press?
It's like what I was going to say. It's like what Rachel said earlier. To be honest, it's, you know, it's eye-catching. It's people, and also the press. They need to report something quickly, and they get, like, you know, they need to go viral and they need to be popular. So essentially, there's not that much of a window to essentially cross-check and make sure that the research has been well studied, and, you know, get the feedback before you present the story, because you need to present, whoever presents it quickest is essentially going to get the most views or the most buys. And like Rachel said, essentially they need to sell a story. So whilst from a healthcare perspective, your goal is the patient, as far as when it comes to the press, the goal essentially is to sell papers and to sell stories. So though that doesn't mean that all the press is just essentially focused on that, but it's something we can't negate the fact that they do need to, like, get views and go viral and sell papers essentially to keep that media source going. So essentially that's why I believe it tends to increase the room for unscientific and unvalidated information out there.
Absolutely, yeah. And I feel like they know that we're all really interested in diet. Diet's fascinating. And, you know, we can tell by the number of people on this call and the panelists and the passion that we're all sharing. We are really interested in diet. So we're going to want to read those kinds of stories. And journalists know that, you know, so they're going to be writing what they can whenever it comes out. It is one of the most popular topics. With that said, I do think that there's a place for always coming back to what can sometimes feel like a bit more of the kind of boring messaging, but that top line key health messaging around diet, you know, things like cut a healthy balance, what a healthy balanced diet actually is. And we can share some really great web pages that CIUK has on that and on helping people to have a healthy balanced diet in general, to reduce their risk of cancer. And sometimes it's about focusing on that rather than any single ingredient or you know, small thing that's come up in the press, thinking more about, okay, what are the proven things that we know about healthy balanced diets, rather than some of these things that feel a little bit more myth-like.
Yeah. I was just having another little look through the Q&A of the things people have been putting in live while we've been here. I can't find the question I just read, but there are a few questions about protein, and sort of several different people have mentioned the importance of protein, that we need to have that, particularly while undergoing treatment for cancer. And there was a question about good sources of protein, so I didn't know if anyone wanted to mention those.
Yeah, so I think I mentioned kind of a couple, but again, some of the resources that we'll share are really helpful. So particularly the World Cancer Research has done a lovely booklet that's got really good tables of good protein sources. I think some of the misinformation around protein can be quite difficult, because what people see as high protein is actually way too much protein. So we kind of eat a particularly high protein diet anyway. So often we are meeting or exceeding our protein requirements just in natural what we eat and drink. But yeah, obviously, meat can be a source of protein, but other things that I mentioned, so beans, pulses, tofu, soya sources, are all really good sources of protein. I think there was some reference as well to kind of different shakes and meal replacements. So I think it's quite difficult to give general advice sometimes, because quite a lot of those things are very specific to what the individual's currently managing, and therefore what would be safe to add in on top of that. A lot of things are also fortified with vitamins and minerals, and as Helen already mentioned, you don't want to be having too much of certain things. So that is quite hard to give general advice to 140 people. So my advice would be, again, if you're worried, having a look at those resources, going back to your oncologist or specialist team. Is there any way you could have access to a dietitian? If not at your sort of hospital or centre, could your GP potentially refer you to more of a community dietitian who may not have specific oncology knowledge, but will at least have diet knowledge and can look at your intake and assess things safely for you. I think that's probably the most helpful I can be, rather than being each of you coming on and letting us analyze what you're currently managing, which I don't think we have time for. But just going back to those resources again, a lot of them have got really quite nice tables about what a good protein diet looks like, how many portions it should be, and what that can look like. So you can do a lot of that input yourself. And then for the more specific things, rather than just going out there and again buying things that could be quite expensive, is seeking that support first and seeing if you can do it in a tailored way for you, would be my advice to that.
I think also to add to that, which Claire said earlier, is that a high protein diet alone will not protect someone from muscle loss or muscle wastage, which is really, really important to reiterate. Exercise, using the muscles, is really key in maintaining muscle mass. And a lot of the evidence behind sarcopenia actually shows that if you were going to do one or the other, doing the exercise is actually more important than high protein diet. So while a high protein diet is important, actually the exercise is more important if you were going to pick one or the other.
Yeah, I mean, I was sometimes saying, if there was such a thing as a perfect diet, if we all ate the perfect diet but we didn't move, we would still waste our muscles. So we need to do that. And the general recommendation for the population is to do 150 minutes of sort of moderate physical activity a week, and that includes people who are having treatment for cancer. And the level of moderate activity is supposed to be where you can talk but you can't sing. Is the level to judge what is right for you. So for someone, it might be really quite difficult to walk very far, and so that might be their moderate activity. Someone else might find that's going upstairs. Someone else might find that they need to run to get that level of the moderate activity. And there are also other activities that aren't specifically just for exercise. So doing your gardening, doing housework, running after your children or grandchildren, or playing golf or swimming. There's a lot of options out there, aren't there? Yeah. Sorry, Helen, did you have something else to say as well, or did it overlap with what?
It was kind of overlapping, but as well, just to say that the resources that we're sharing give you an idea of what kind of your protein recommendation should be based on your weight and your age and things. So just if you're interested in how much specifically to aim for, the resources that we're sharing cover some of that.
Oh, wonderful. Yeah, there was a question actually there about what the recommendations are for protein intake. So for the general population, you can think it's about 0.7 to 1 gram per kilogram for people who are of the sort of a target weight, but that's different for people who have got other things going on. So this is another reason to see a specialist dietitian, to tailor it for the individual. Lovely. Thank you. I'm aware that we're coming to the last few minutes of our webinar here. So unless, I don't know if the panelists have any other last bits that they wanted to say that I haven't covered. Give you the opportunity. No. So thank you very much to everyone that has tuned in today, who has asked questions, who's engaged with us. So thank you very much for listening. Thank you for our wonderful panelists and your excellent breadth of knowledge that you've all got, that you've shared with us all today. Lovely to share the morning with you all, and enjoy your lunch, enjoy your food. think about what's in it, but not to the extent that it becomes just a fuel and a series of nutrients and things. So, you know, the enjoyment of food is probably what brought most of us to spend our lives talking about it, and we want everyone to keep enjoying their food as well. So have a good lunch. Take care. Bye.
Thank you very much. Bye.
Bye. Thank you.
Bye.